Good afternoon. My name is Diana Phillip. I'm the Executive Director for NARAL ProChoice Maryland, and welcome to our webinar, our Wednesdays at noon webinar. And today our topic is the intersection of reproductive freedom and childcare. Why is childcare a reproductive freedom issue? And with us today, we have Laura Weeldreyer from the Maryland Family Network. And so Laura and I are going to have a conversation about childcare in the United States and how we should care about this within the reproductive freedom movement. So again, thank you everybody for coming. Let's start with the first question, Laura. Unless Laura, do you want to say a little bit about you and your organization first, actually? Sorry about that.
Sure, I'll take a minute. Hi, everybody. I'm Laura Weeldreyer. I'm the Executive Director at Maryland Family Network, which is a statewide nonprofit organization in Maryland that works on supporting families and children from ages 0 to 5. We do a wide range of work in terms of childcare, family support centers, early Head Start, and a lot of advocacy and policy work in Annapolis as well. And I'm happy to be here. Thanks for inviting me, Diana.
No problem. Thank you, Laura. All right, first question. What is a connection between reproductive freedom and childcare?
So I spent some time thinking about this before our webinar today, because on one hand, it seemed like, well, there's a simple answer to that. And then I wanted to really make sure I had thought about all of the answers to that. I mean, I think the basic premise of reproductive freedom is that women should choose and control when and how to have a child, or if, when, and how to have a child, and that if a child is had, there should be adequate societal, governmental supports to make raising that child possible in today's society. So what I kept coming back to is that on all of these questions, there's a theme of shame related to being a woman, right? So why don't you have kids? Why would you have an abortion? Why do you have so many children? Why do you have kids if you can't afford them? Shouldn't you have just given the baby up for adoption? Why don't you have a job? Why do you have a job? Why aren't you at home with your kids? I mean, it's truly a no-win situation for women. There are so many contradictions in the things that society expects of us as women and as mothers. And I think the cumulative effect of those conflicts is to silence women about these issues. You know, women don't talk about whether they've had an abortion. Women don't talk about the conflict of whether they should work or stay at home, about being, you know, progressive working women and then feeling guilty about leaving your child in childcare, and how to navigate some of those really personal, intimate decisions. But I'm here to tell you that there's actually so many pressures on women all the time. At some point, we'll talk about the pressures in the last 8 months related to COVID, because that has only amplified everything, right? But in this country, there's actually not a single state in the entire country where childcare meets the federal government's definition of affordable. So there are many women in this country who actually work just to pay for childcare, which just seems really crazy, right? We don't have national paid family leave or consistent government sponsored or paid for access to high quality childcare. Many people want to stop women from having abortions, but they don't back policies that would make it easier to raise children should you have a baby. So it's the contradictions that I think this conversation represents, like cut across individual women's experiences, all the way up to state and federal policy. So that is one of the big connections. I think the other connection is that women are the child care providers in this country. So again, whether it's from a personal connection or it is your literal professional life, child care providers are largely women and largely minority women. And child cares are largely women and minority owned businesses. So there's a lot of sort of overlap and layering of the connections between these issues.
Would you like to expand a little bit more about why childcare is important?
I would be happy to talk about that. I mean, honestly, in the last 8 months, I could have dropped everything I'm doing and work only on childcare because childcare is in such a state of crisis. And that could have been true for me and my whole organization staff, and still it wouldn't have been enough. And we would only be working on Maryland, not the rest of the states in the country, right? So first of all, in terms of parents and children, there was recently an article in the New York Times, which I thought was pretty amazing, that had a quote that mothers are the shock absorbers of our system, and the poorer and more precarious you are, the more shock you're expected to absorb. So our current situation has totally flattened industries in which largely employ women: restaurants, retail establishments, hospitality, healthcare. So women are taking the brunt of the economic downturn much more heavily than men. That has not always been true. Like in the 2007 to 9 recession, that hit men and women more equally or more similarly. But in the past 8 months, so many more women have either lost their jobs or had to choose to leave the labor force because schools are closed and childcare in not all states, but in many states was closed for a time. And even though in Maryland, childcare is reopened, I think parents have a huge amount of confusion about whether it's safe to send your children to childcare right now. So if you think about the current situation, again, for families, and I'll talk about childcare as an industry in a moment, but for families and children, one thing is you're not sure if childcare is safe. Another issue is if you have older children, they're probably home from school. Obviously, my knowledge is mostly about Maryland. I think you can extrapolate it a little bit, but I'm mostly talking about Maryland. So your older kids, if you have them, are home. So why would I pay to take my younger child to childcare if I'm already dealing with kids at home? Maybe I've lost my job, or I've been furloughed, or I'm working from home. I think people's lives are in chaos, and all of that means that kids are at home. My great worry about the impact of that is that one, older siblings have become de facto childcare providers. That's one of my worries. Another worry is that young children are not getting the developmental support, stimulation, exposure that they need. For example, babies and toddlers learn so much about exploring their worlds, whether that is a trip to the grocery store, a trip to the playground, a play group, or childcare. And I think those things are happening with much less frequency and much less regularity right now for very good reasons. But none of us knows what the longer term developmental impact will be for children, whether it's their social emotional development, their academic readiness, it's their language development. It's very unclear, right? I also greatly worry because a part of the way our limited system of supports for families work is through referrals. And those referrals happen through observation. So whether it's the pediatrician observing that a child's speech development is delayed and referring a child to Maryland Infants and Toddlers, or a teacher or another caregiver being concerned about a child's welfare and making a referral to Child Protective Services, all kinds of referrals. So I don't want it to just be referrals where you think of something, bad or dangerous, but all kinds of referrals from early intervention to speech therapy, et cetera, are way down. Pediatricians, child visits are way down. Vaccinations are way down, which brings up other potential public health crises. So I do think that women, mothers, are bearing more than their share of the current crisis. And again, I think we know historically that when women leave the labor force, there are a lot of obstacles to re-entering the labor force. And so right now, the best that we have is like predictions from economists and other experts who study this, but nobody really knows, again, the long-term impact for children or for women. For childcare providers who are also, as I said, largely women, in the best of times, childcare operates on a razor-thin margin. And so being that this is not currently the best of times, you can imagine that they're really in free fall. Back in, I guess, late April, early May, there were some national surveys done by like the National Association for the Education of Young Children that predicted a catastrophic crisis for the field of childcare. They predicted that as many as 50% of childcare providers in this country may permanently close due to the global pandemic. States were like, oh, well, that's a national survey. It's probably better here. Like, we have more supports, more infrastructure. So we better do our own survey and find out if that's true. So actually, Maryland Family Network did a statewide survey of childcare providers, sort of mimicking these national surveys in early May. And our numbers, as were the numbers in Virginia, Louisiana, North Carolina, other states that took on doing a statewide survey, the numbers were very steady and very consistent. So there is, as we just were discussing, a terrible ripple effect if we lose childcare. So let me dwell on that for a moment and say, within the state of Maryland, there are areas, counties that are real childcare deserts where there are not enough childcare slots. We would say like seats in a school, so slots for children to be served in childcare to meet the needs of the population, you know, again, in the best of times, because it is rarely seen as a financially sustainable business, certainly not a profitable business. So in a time when childcare got shut down at the end of March, and the only way to be open was to agree to serve the children of essential personnel, which meant you were seeing sort of a high-risk group. These were the children of like people who work in hospitals. And still the role that young children play in spreading the virus or passing the virus on, much less getting sick themselves, is really unknown. I think most of us think like it's a minimal role, but then we read stories of really terrible things that have happened to kids, and very unpredictable and unexpected things. You know, the COVID toes, or, you know, very dramatic things that get some media attention, and I think reignite parents' fear about what it means to have your kid in childcare. So all of that is to say, there, especially for family childcare providers who skew a little bit older, I think people were weighing, I don't know what having children of essential personnel with this group of adults may mean to our health, to children's health. If I'm a family childcare provider, I'm actually inviting them into my home and putting my entire family at risk. And if I'm a little bit older as a family childcare provider, I'm also weighing like, what is my risk? And by the way, just to parallel the situation a little bit to schools, and I've spent 25 years of my life working on K-12 education reform, and nobody is a bigger, you know, ally and fan of teachers than me. I was a teacher myself. My husband was a teacher for 22 years and is a principal. But when I hear people, you know, the conflict over whether schools should be open or closed right now, I think to myself, teachers have unions, have great healthcare benefits, often have access to paid FMLA. Childcare providers make, on average, $12 an hour, rarely have any union representation, almost never have sufficient healthcare benefits, and certainly do not have access to paid leave. So, and are expected to be open right now. So there's so much inequality, and it's hard not to assume that part of that is because so many childcare providers are Black or brown, poor and disenfranchised themselves. If we lose significant childcare slots in this state, there is, again, we've talked about the ripple effect on children's development. It is also a showstopper for reopening the economy. And if we were in a time in the United States where we had, let's say, credible national leadership who was thinking about these issues, we could have looked to Europe, which was 6 to 8 weeks ahead of us in this, right? And started to reopen before the United States did. There were news stories coming out of Italy and Spain that when they attempted to reopen the economy, people showed up the first day of work and went straight to their HR department and said, I need to take paid leave because my kids are at home. Childcare is closed, school is closed. This was not an unforeseen circumstance. It was entirely predictable. But even in Maryland, we have not taken sufficient steps on any front. We have not done enough to support childcare. So right now there's about 6 counties who have put grant programs in place for childcare providers to get access to money. So it's like Howard County, Montgomery County, Baltimore City, Frederick, I think Anne Arundel, and Baltimore County as well. So certainly the large, Prince George's County, the largest counties, with the highest number of providers. But when I say they've made money available, those grants range in size from $7,500 to $75,000. So, $7,500 is not going to save anybody from closing. In our survey that we did in May, childcare centers are losing right now, since March of 2020, an average of $55,000 a month, and family providers are losing about $5,000 a month. So to be clear, childcare is reopened right now, at least for the time being. I listened to the governor's press conference yesterday to see what restrictions he was going to announce. So for the moment, childcare is still open, but it is grossly under-enrolled. Now, if you hear the state talk, they will tell you that 87% of licensed childcare has reopened in Maryland. And I think in large part, they are saying that to push back against the narrative that we might lose 50% of childcare. And the truth is the state doesn't really know how much of childcare has reopened. 87% of licensed childcare, this is what this statistic really means. 87% of licensed childcare has turned in a form to the Office of Child Care saying they intend to reopen. That's all. That's the only thing the state can track. They cannot track enrollment or attendance the way we do in schools. Seems very basic, but remember that childcare are all private businesses. There is no state system of data collection or any ability to really track what's happening. So anecdotally, we know that childcare centers are maybe half enrolled. So I will use Little Flowers Childcare in West Baltimore as an example. Before March of 2020, they served 160 children. Right now, they have 90 children enrolled and about 45 who show up every day. And the reason I make that point is because Little Flowers is a childcare center in Sandtown, Winchester, which serves 99% of the children receive childcare, what's called childcare scholarship in Maryland. You may also know it as childcare subsidy payments. So their childcare is subsidized by the state and the federal government. And that is really the one public investment in childcare in this country is through childcare subsidy. That subsidy payment is paid based on attendance, not enrollment. So that means going from 160 kids 5 days a week in early March to 45-ish kids every day in November of 2020. Fixed expenses don't change. Rent, utilities. I mean, unfortunately, most childcare centers at this point have laid people off because they just don't have the reserves to keep going. Some of you might be thinking like, well, what about all those like Paycheck Protection Plan loans or Small Business Administration loans? The truth is that most childcare providers, I will exempt things like childcare chains. So like Goddard, like chains that have multiple centers. They probably do have a back office and administrative capacity to apply for grants like that. In Maryland, though, and actually I think this is true nationally, individual childcare providers, which is the bulk of childcare providers, do not have either the records or the financial know-how to navigate those loan programs. I run a statewide nonprofit with a very experienced chief financial officer who's been with us for 15 years. She has a 3-person full-time team and is, really, really good at her job. And it took her more than 40 hours to complete the Paycheck Protection Plan loan application. And she had access to all kinds of support and help. From our auditors to our payroll service. So these were not small undertakings. In Montgomery County, which was one of the first counties to make loans available, one of the things they found is that for a lot of women, especially family child care providers, they are literally transacting their business in cash. They don't have checking accounts. They don't have any whether you run a business that employs parents, there are, far-reaching consequences of what's happening with childcare right now. So while 87% have said they will reopen, I do not think that reflects what the long-term fallout will be.
Laura, I was wondering if you're interested in talking about how childcare access tells the story of women's rights in this country.
Probably this is like a dissertation topic, or somebody could write a big book about this. So I will touch on a few things, and that is if you and actually a lot of this history is bound up with our organizational history, which is how I know some of it. So that's kind of interesting. Maryland Family Network actually was the merger of 2 organizations, and one of those organizations was called the Maryland Committee for Children. So the first time that childcare really got governmental attention in this country was in World War II, when women needed to join the workforce because men were overseas as soldiers. So that was a time when the federal government set up supports for childcare. They passed something called legislation called the Lanham Act in 1943 to subsidize full day, year-round childcare for up to 6 days a week. And they did that so that we could have Rosie the Riveter, And so Maryland Committee for Children started out of World War II efforts because there were a group of progressive women in Baltimore who were forward thinking, and thought women are going to stay in the workforce after World War II, and we're going to need these childcare supports to continue. But actually, that funding ended in 1946, and the federal government was like, oh, veterans are back, women can go home, childcare not needed anymore. So between 1946 and the mid-60s, childcare got very little attention from the federal government. And then in 1965, Head Start was created with a focus on subsidizing childcare for low-income children between 3 and 5 years old. So that was, a more recent effort. In the 70s, when the trend was very clear nationally that women were working and the percentage of women working outside the house was increasing, there was, again, a push to create federal support for universal childcare. And I find this because it seems in our, I don't know the age of everybody on the call, but at least in my view, the 70s seems like such the recent past. I find this kind of fascinating. A Democratic senator named Walter Mondale, who later went on to run for president, introduced something called the Comprehensive Child Development Act, which was, hard to believe, a bipartisan bill to provide universal childcare for all children in the US. And there was tremendous support for this legislation. But through an unfortunate series of timing, really, this legislation got sort of conflated with the Equal Rights Amendment. And so people who were lobbying and advocating against the ERA, people like Phyllis Schlafly, wanted to stamp out any effort to provide universal childcare because they felt it would actually incentivize women to work outside of the home and would erode the family unit. And so in 1972, Richard Nixon vetoed this piece of legislation. And he actually used the Cold War and the fears about the Soviet Union to say that this was actually an attempt to Sovietize American families. So he really villainized this effort, right? It seems very crazy in retrospect, but also super interesting how politicized this issue was. So really, since then, there have been smaller efforts, but nothing huge. And that brings us to much more recent history in the 90s, where Family and Medical Leave Act was passed, and things like welfare reform happened, and childcare got caught up in these efforts as well, for some good reasons and some not so good reasons. I mean, FMLA first drew our attention to parents needing leave after they have a child or adopt a child, or for 1,000 other reasons as well, right? Maybe they're ill, maybe their parents are ill. So could be a lot of reasons. Unfortunately, FMLA is unpaid. And what we know at this point is that most people cannot afford to take up to 12 weeks of unpaid leave. So while your job protection is there, few of us, I couldn't go for 3 months without getting paid, and very few people can either. So I'll come back to that point in a second. And then with things like welfare reform and the push for poor women to document that they were looking for work, that raised, awareness that if poor women were going to work, they would need childcare. So in the late 90s, early Head Start was started by the federal government, and that is the companion to Head Start, except it's for 0 to 3-year-olds. Interestingly enough, just one political word about that, in the beginning, Head Start was very much viewed as a 2-generation program, meaning parents and children came to Head Start together. So there were all these supports for parents. There was job training, there was like parenting classes. There was also things like GED and adult basic education, nutrition counseling, case management, home visiting, connection to lots of other services. Really, though, in the past decade, Head Start has swung the other direction from that. And now Head Start prioritizes families who are working or are in school full time. So there's very limited expectation for parents to be engaged in Head Start. And so I'm not saying that in a judgmental way. We know that even parents who work might still be poor in this country and might still need high quality subsidized childcare. But at the same time, that 2-generation, like the supports for parents that used to be present in Head Start really barely exist anymore. There's like some sort of historical remnants of it, but really the current funding streams don't support that anymore. So I told you earlier that Maryland Family Network does a lot of advocacy, and I just want to tie that history to some of our current advocacy that Diana and your organization has been involved in as well. And that is really improving on FMLA to institute paid family and medical leave in this country. So if you want to be very shocked by a statistic, I don't know, does anybody have any shock left in them in 2020? Consider. If you can dredge up a little shock, I will share with you a statistic which I find just like jaw-dropping, and that is that the United States is the only industrialized country in the world that does not have paid family and medical leave. Crazy. Countries with so much less national wealth than us subsidize the ability for parents to stay at home after a major medical event or the birth or adoption of a child. So in Maryland right now, advocates like Diana and myself and others, actually a really great coalition, because it is an issue that brings so many groups together. It brings AARP to the table. It brings people who care about early childhood to the table, people who care about women's rights to the table, lots of religious organizations, very progressive people, unions. Anyway, it's an interesting array of organizations and individuals are lobbying the state government for up to 12 weeks of paid family leave. And we've been working on it now for 2 years. We are headed into the third General Assembly session working on this. And ironically, you would think, wow, we're in the middle of a global pandemic. What further evidence does anybody need to pass a paid family and medical leave act? But the thing that's been very eye-opening to me, I'm sure Diana is going to think I sound like this naive Pollyanna, true, possible, is that in this country, we really care so much more about businesses than we do about people. And there's a long history of legislation and Supreme Court cases that really confer more rights to businesses than they do to individuals, which is really grim. And so in this moment when individuals are suffering like crazy for all of the reasons I just talked about, what the General Assembly's response to this legislation last year was, and you can imagine it's 50 times louder this year, is, but what about small businesses? Can they afford to pay into paid family and medical leave? So I should have said, the great thing from a governmental point of view is there's no cost to paid family and leave. And I'm sure you're thinking, like, how can that be true? There's a neutral fiscal impact. Because like Social Security, it's like an insurance fund where employees and employers split the cost. That's what we've proposed, a 50-50 split. And out of every paycheck into this fund that pays for itself. It covers the administration of the fund, and it covers the payouts to individuals. The fund would need to be open for a year, collecting those fees before we could pay out. So that's another thing of like, time is of the essence, right? Because it'll take a year to build up enough money to actually pay the benefits. So we had proposed a split between employees and employers. And last year, the small business associations, the Chamber of Commerce went berserk and got the ear of lawmakers to say that this would be too hard on small businesses. So a compromise that was brokered, and I assume will be back this year, is that employers with under a certain number of employees would be exempt from paying. Not that their employees would be exempt. I feel really strongly about that. There are tens of thousands of Marylanders who are employed in businesses with under 50 employees. I don't remember if that's the exact cutoff, but that is a typical cutoff. Like you're a small business, if you have under 50 employees, and the minute you get 50, you fall into a whole new category. So that's tens of thousands of people, and I don't want them left out of this legislation. So the compromise that was brokered is that larger employers would actually pay a little bit more and subsidize the smaller employers. So employees would still pay. Again, nobody cares if the individual has to pay, but the employers would be exempt from paying it. So, you know, I try to always be hopeful. Along with shock, it's another hard thing to muster in 2020, but I'm giving it my best shot here, and I'm trying to be hopeful that there will be enough hue and cry for this legislation this year. Again, given that there is no fiscal impact on the state, and given this potential exemption for small business owners. So this means like Hopkins or Lockheed Martin or Northrop Grumman would pay more than their share, so that smaller employers, the mom and pop, you know, grocery store or t-shirt stand in Ocean City for whatever reason is always the favorite example, or the little restaurant that's probably barely hanging on anyway, or small childcare businesses would not have to make this contribution for their employees. So I spent all this time on paid family leave because just in the scope of this discussion, there are policies that international organizations recognize as making countries more or less family friendly. So paid family leave is one of them, although to be honest with you, as much as we have been fighting for this for going on 3 years, our 12 weeks doesn't meet the international benchmark of a family-friendly policy. UNICEF, not the most controversial of organizations, thinks that it needs to be a minimum of 6 months of paid family leave for parents. The UNICEF would also say universal, high-quality, age-appropriate childcare is another foundational policy that needs to be in place, and that some forward-thinking federal agency needs to ensure that there's no gap between the end of paid family leave and the start of affordable childcare. Because one thing we know about child development is that caring, consistent adults are really key to kids maximizing their development. And I didn't say this before, but for anybody who doesn't know, 90% of your brain development happens by the age of 5. And actually it's probably like 80% by the age of 3. So you might be thinking to yourself, like, I mean, I can still learn things. Yeah, but not as easily as you did when you were 2 or 4. That's why, just an example that I think is, you know, commonly thought of, that's why little kids can learn another language so quickly, because their brains are literally so pliable and soaking things up in a way that does not go on for your entire life. So could I learn to speak Italian? Yes, but it would take years and I would probably never be great at it. But a 2-year-old could be great at it like that, like in a shockingly short amount of time. So one of the keys to maximizing that time is the consistent presence of a caring adult. And that could be a parent or it could be a caregiver. And I say that in part, I know I'm like all over the place, but one of the reasons that's important is because childcare is such a low paid industry that there's a ton of turnover. You know, when we at Maryland Family Network advertise for teacher jobs in our early Head Start centers, we will literally get 500 applicants because we pay $15 an hour. And that is so much more than the going rate, even though it's a shamefully low rate. Like, I'm not sitting here saying like, good job, Maryland Family Network, but it's so much more than the super majority of childcare centers or other Head Start providers pay, that we get 500 applicants for one teacher position. So that means just by the facts of life that there's a ton of teacher turnover, and also that you're probably not attracting the most qualified people, right? So I was a teacher, I taught pre-K as a teacher. So I taught 4-year-olds, and I made $45,000 here. It was a while ago, but I made $45,000 a year versus $12 or $15 an hour. And I was literally teaching the same kids. It's just that in my case, they were sitting in a school instead of in a Head Start or a childcare center. So this is something that more progressive mayors and county executives are grappling with. So in New York City, they're really trying to equalize childcare to K-12. So really interesting, hugely expensive. So again, we're just asking for paid family leave that has no fiscal impact on the state government. And I think that is important given that every state is facing, an economic crisis right now, the likes of which, there's no governor who knows how to navigate this. So I think that is important, that it's not a cost that the state would bear. I think it's important in that I think it gives us a better chance of getting the legislation passed. Not that I don't think the state has a fiscal responsibility. And then just to finish out the family-friendly policies, and then maybe we'll see if people have questions. To round out those family-friendly policies, you also need policies that support breastfeeding. So that means space to breastfeed, time to breastfeed, and no stigma around breastfeeding. And finally, there has to be access to abortion because, again, the choice to have a family is the foundation of this whole discussion, right? And women have got to be able to make that choice for themselves about controlling their body and deciding if motherhood is the right path for them. So that is, according to UNICEF, again, this isn't like, a controversial organization. We all collected pennies for them when we were kids and trick-or-treating. So those are the core policies that UNICEF says a country must have to be family friendly. And we don't have any of them in this country. And we are the richest country in the world. So I think that gives you a little bit of sense of how the government feels about women and parenthood and families, that it's on you, as are so many things in this country. It is about the individual figuring out how to make this work. It is not about systems of support. And I think in 2020, we need to have a real reckoning with access to systems of support, seeing systems of support as a piece of the equity conversation, and also talking about the quality and accessibility of our current systems of support, which is really limited in some cases, I'm sorry to say. Okay, I would love to take questions because I really just talked for a remarkably long period of time. And I did see people in the chat saying that I froze. Sometimes I'm sorry. I have teenagers. There's a lot of competition for bandwidth in my house. So if there were things that you missed, hit me and I will try to recreate.
And while folks are using the chat function for questions that they have, I just wanted to talk about how our organization is involved in so many different coalitions that address economic security. And that economic security does figure into pregnancy decision-making, or whether or not you want to add to your existing family, if you want to open your homes to foster care and adoption so you can grow your family. And so the Time to Care Coalition, which the Maryland Family Network is the lead advocacy organization for, is taking on this paid family leave bill. And in the past, in the last several years, we've passed the Fight for 15, we've passed the Sick and Safe Leave legislation, which took 6 years to do, including a gubernatorial veto that we were able to override. The implementation is still a difficulty with Sick and Safe Leave. And another piece that needs to happen, that for the last couple of years this bill has not been introduced, is the idea about fair scheduling. So that way the hourly workers have an ability to know 2 to 3 weeks in advance exactly what's going to be happening with their schedules. Because, not only is it difficult to identify the childcare that's going to work with you, you have to be really consistent and reliable about dropping off your child and picking up your child. And if your work is interfering with that, you're going to lose your placement. And so knowing what your schedule is ahead of time is incredibly important. And then some of the legislation that we've been working on is on the rights of pregnant and parenting students. And so there's a couple of bills that we're reintroducing this session that got stopped last session because we adjourned 19 days early. And it's a Smart Start bills in which we're trying to encourage and mandate that there are liaisons in each of the secondary schools that will help parenting students secure resources for transportation, lactation spaces, and childcare. Because childcare is the #1 reason why our young people who give birth while they're school aged don't return to school. It's the #1 reason. They don't have access to it. And so we're trying to figure out the best way that, did I freeze? No, okay. Sorry, because it's usually my internet that's always having the problem. We're trying to figure out the best way that we can more easily facilitate access for parenting students to have subsidies, to have childcare, so that way they can stay in school on track to graduate, because they need the diplomas for the economic security. And so one of the things that really got highlighted with COVID-19 is that the emphasis was on trying to get childcare to working parents before and after school, but not during school, when unemployed parents are trying to find work, and parenting students cannot engage meaningfully in remote learning if they have to take care of their babies at the same time. And for those of you who know what this is like with Zoom calls with other people's kids and cats and dogs, I can't even imagine what it's like, you know, for teen parents, quite frankly, who have to take care of their own children, if not their own younger siblings in the house, right? And really engage in school. And I think we probably have lost a lot of students.
Yeah.
Right? And this is a real problem.
Well, I'll match your statistic about teen parents and say that childcare is the #1 reason why parents miss work and call in sick to work. So the great news is that I think there's no audience you cannot frame the childcare crisis for. So if you're talking to the Chamber of Commerce or the Small Business Association, it can be about lost productivity and lost wages. There's an angle on this, which I think you can appeal to a lot of different audiences on. And I find that useful in the work that we do, is like, it really does touch so many aspects of society.
Go ahead, Laura.
I was just going to say, in the chat, somebody said that I guess I froze when I was talking about Montgomery County. I was just saying that in making loans available to child care providers in Montgomery County, a real kind of shocking thing that was discovered is how many child care providers are running cash businesses. So they are collecting tuition in cash. They don't even have bank accounts. And I think that's more common than we might like to think. Is like, they're basically kind of acting like grown-up babysitters. Like, I'm taking your payment in cash, I'm putting it in a coffee can under my mattress, so the point I was making is they just simply didn't have the documentation for some of the large scale grants that were being made to small business owners or loans. They didn't have what was needed to submit. Okay, Suzanne asked, how do we develop higher quality childcare if being paid so low? And Kathleen, I see you were raising your hand, so I'll come to you next. So every state has something called a quality rating system, where childcare it's a way of saying who is high quality in terms of childcare provision and who is not. It is a very imperfect system. It's like the same debate over whether test scores tell you if a school is good, right? So it has tremendous limitations, but it's something, and you could start by looking at that. So in Maryland, one of the things MFN does is we run a network of childcare resource centers that serve every area of the state, and they provide a lot of training, technical assistance, and coaching. And one of the goals is to get people to move up the ladder in the quality rating system. In Maryland, that quality rating system is called Maryland Excels. And so you can be not in the system at all. You have to enroll in the system. And the state used to provide incentives when they had a federal grant to do so. They don't have that money anymore. So some people just avoid the whole thing because it's like tangling with the bureaucracy and it's a headache. But there are reasons to tangle with it. I'm not sure, like, because I'm not a child care provider, I probably don't know how much of a headache it is, but I deal with the state and I could probably give an educated guess. The point is, you come into the system and you have to meet certain benchmarks to climb from a 1 to 1 being the lowest and 5 being the highest. The biggest reason why is the higher you get on that ladder, the more you get in terms of childcare subsidy reimbursement. Again, this is imperfect. Not every childcare provider accepts childcare subsidy, but if those are the kids we're most worried about, if those are the most vulnerable kids who need access to the highest quality, this is a good financial incentive because you get paid for those kids by the state, and your reimbursement rate will go up if you reach a level 4 or a level 5. There are only about 100 providers in the entire state of Maryland at a level 5. So it's rarefied space. There are a lot of people thinking about childcare from a workforce development angle. There's a whole Washington, D.C. area initiative that is thinking about workforce development and economic development and trying to figure out how to raise wages of childcare providers. So that's like Prince George's County and Montgomery County being paid for by a philanthropic group called the Washington Area Women's Foundation. So they're really trying to get these counties to think about the investment in childcare as part of what makes their counties livable, and how the county might, I'm not sure if they're thinking about subsidies or set like a salary scale the way we do in school systems, I'm not sure. And then honestly, I think the real future is what I mentioned about New York City, which is thinking about bringing childcare in line with K-12. And you might think that sounds very far-fetched, but let me tell you why I don't think it's so far-fetched. In Maryland, last year, the legislature passed the Kirwan Commission's recommendations, or the blueprint for education reform, or I don't know, it has many names, but Kirwan is really what we all call it. The governor vetoed it. There is every expectation, even in this crazy time, that the legislature is going to override that veto when the General Assembly reconvenes, much like the Fight for 15, the paid sick leave that Diana referenced earlier. In the Kirwan recommendations, there is a call for a huge expansion of pre-K. So not only to make 4-year-old pre-K practically universal, although they avoid using the word universal, they also want to drop it down to 3-year-old pre-K, which is great. Big fan of the recommendations. If you are a school system, you're freaking out. My God, we don't have facilities to serve all of these kids who we're going to suddenly have to serve in full day programs. So in order to appease the school systems, the state put language into those recommendations that calls for diverse delivery of pre-K. It's kind of a nebulous term, probably doesn't immediately ring any bells, but what does it mean? It means childcare providers could provide public pre-kindergarten. And the state is actually doing that now through something called the Pre-K Expansion Grant. So that childcare center I told you in West Baltimore, Little Flowers Childcare in Sandtown, Winchester. First of all, it's at a level 5 and excels. Second of all, it hosts 2 public pre-K classrooms, which means you have all of a sudden teachers getting paid public school wages in childcare spaces. And boy, I think that is going to foment so much demand for childcare providers to be paid at least in the ballpark of public school teachers. Because now it's not just, when I gave you my example, that I was teaching 4-year-olds who just happened to be sitting in a school, versus this is the teacher in the room next to me is making thousands of dollars more than me every year and has great health insurance and is part of the state retirement system. So I think that that reckoning is coming. But no, it won't be the first thing that happens based on Kirwan, but still we should be learning from what this is costing and how it's happening in New York City.
And also every legislature legislative session, we put out these bills about economic security, and we keep trying to convince people that folks are looking forward in their career development to find the spaces in order to raise the families in the ways that they want to. And there are people that will look next door to Virginia and DC and move. They'll move out of Maryland if they don't have the kinds of accommodations that they deserve. And people don't get that we're not being able to invest in the kind of a workforce that we want. And if we want to keep them, you know, we have to make these investments because it's the best thing for our economy. It's the best thing for our families.
So by the way, DC has paid family and medical leave. There are 9 states plus DC that already have that policy, and DC has universal 3- and 4-year-old pre-K. So just throwing that out there if anybody's thinking about moving. Kathleen, were you raising your hand before because you wanted to ask a question?
First of all, you mentioned the Fed definition of affordable childcare. So what is that? And the second is, what are the qualifications of the childcare, you know, the educational qualifications of people that are running the childcare? Is there any requirements and so on? And do the colleges meet that need of 2-year schools, for instance, you know, what we used to call junior college, have programs for childcare provider education?
So because there's no requirement for a college degree to work in childcare, there are like certifications, but they're, unlike teacher certifications, they're not tied to degrees. They're like there's a 90-hour basic certification that is generally procured at a community college, but there are online programs, and there are other, like our childcare resource centers that provide a lot of training. So it doesn't have to come linked to a college.
Right.
So if we got serious about this workforce, and this is like a chicken and egg question. So I'm trying to present this clearly, but it is complicated because there are organizations that are really, really advocating for raising the standards for care. So National Association for Education of Young Children, they want to say that childcare providers must have a minimum of a 2-year degree. But if you don't raise the wages, like, first of all, it's just, I mean, think about people coming out of college with student loan debt. I mean, are we going to forgive all of that loan debt if they go into childcare? I've never heard a proposal for that. And second of all, if they're already in childcare, who could afford to be taking college classes when you're making $12 an hour? Even Chipotle and Royal Farms will pay for their employees to take college classes if they're going to be on the management track. So, I mean, maybe we need to think about things really, really differently. There are, again, divorced from higher education. There's something called the CDA, the Child Development. Why can't I think of what the A stands for? But it is thought of to be a very high bar for improving quality. The state of Maryland just got in the current year's budget, $1 million from the state to pay for teachers to go through the CDA program. And what I like about it is it's classes, but it's kind of like the National Teacher Certification Program. You have to take videos of yourself. You have to turn in artifacts. You have somebody who's coming and observing you. So it's not just classes, which I think we all know do not necessarily translate into higher quality interactions between children and adults. But in this case, it's a really different kind of assessment. Maybe it's the child development assessment. But anyway, the point is, it actually, I think, is much more suited to adult learners and has you turning in these artifacts and real people checking to see, like, does Laura know what she's talking about? Like, is she designing developmentally appropriate lessons? And then observing me to see, like, am I screaming at kids? Am I punishing kids? You know, like, just some basics that we know are issues in classrooms. So your question about the definition, I was going to try to Google it quickly, but I'm just going to admit to you that I don't know it off the top of my head. But it's like it's like saying that your rent or mortgage payment shouldn't be more than 25% of your monthly income.
Right.
For most families of young children, their highest expense is childcare.
Yeah.
It is more than rent or mortgage or anything else
Right.
they pay. So I think it's the same kind of like a ratio or percentage.
Right.
And this is really important because the cost of childcare and what people can afford to pay for it actually is what drives the childcare subsidy rate that the state and federal government pay. In many ways, that more than anything else shapes the subsidy rate. So that is why there's actually an inherent inequity in childcare subsidy, because wealthier communities, so I'm going to use Maryland, Montgomery County families can pay a higher tuition rate to childcare than Baltimore City families. So the subsidy rate, which again is driven by something called a market rate survey, Montgomery County childcare providers get a higher subsidy rate than Baltimore City childcare providers, because what families can pay in tuition is the real factor that shapes that. So it's like we're just reproducing societal inequities in these systems, which are supposed to be systems of support. Now, I don't think the state, well, let's say I don't know if the state understands that. In recent years, there are a handful of places in the country that are trying different methods of calculating childcare subsidy. That's still pretty like cutting edge work. But again, we're one of the wealthiest states in the wealthiest country in the world. Why wouldn't we be part of that cutting edge and thinking about these things differently? There's no legislative mandate to calculate subsidy in the way that we're calculating it now.
Okay. Got it.
Thanks for your question.
Okay, I'm being sensitive about the time. We're at 1:08. Is there one last burning question for Laura? If not, I don't know, Laura, if you have a closing statement or anything.
Just thank you. I hope that this helped illuminate what is I think a surprisingly complex social issue. I really thank you for your attention and your time.
Thank you, Laura, for all your great work. Folks, thank you for joining us. We'll have the recording posted to people who registered. And next week, we're doing the intersection of disability rights and reproductive justice. Thank you.
Thanks, Diana.
Thank you.
Take care and stay safe.
Thanks.